Dupilumab efficacy and safety in moderate to severe uncontrolled asthma. Definition: asthma is a chronic lung disease that inflames and narrows the airways. Asthma causes recurring periods of wheezing, a whistling sound when you breathe, chest tightness, shortness of breath, and coughing. The coughing often occurs at night or early in the morning. Asthma affects people of all ages, but it most often starts during childhood. In the United States, more than 25 million people are known to have asthma. About 7 million of these people are children.
This is Jeffrey Drazen for the New England Journal of Medicine. Asthma associated with a type 2 immune response is characterized by increased numbers of type 2 helper T cells in the airway, mast cell activation, eosinophilic airway infiltration, and the release of pro-inflammatory cytokine, including interleukins 4, 5, and 13. Dupilumab is a monoclonal antibody that blocks cytokine signaling by interleukins 4 and 13. It has the potential to decrease type 2 immune responses. This randomized, double-blind, placebo-controlled, parallel group trial assessed the efficacy of dupilumab in just over 1,900 patients with moderate to severe asthma that was refractory to maximized standard of care control or therapy. Patients were randomized to receive 200 or 300 milligrams of dupilumab or placebo by subcutaneous injection every 2 weeks for 52 weeks in addition to the usual treatment. The primary outcome was the annualized rate of severe exacerbations. At 52 weeks, the exacerbation rate was 0.46 in patients who received 200 milligrams of dupilumab and 0.87 in patients who received placebo. Similar results were seen with the higher dose of dupilumab. The absolute change from baseline to week 12 in the pre-bronchodilator forced expiratory volume in 1 second, the FEV1, was also assessed. At 12 weeks, the mean change in FEV1 in patients randomized to dupilumab was significantly greater than change with placebo. In addition to injection site reactions, which were more common in the dupilumab group, just over 4% of patients receiving dupilumab versus 0.6% with placebo developed transient blood eosinophilia. The authors conclude that dupilumab provided a significant reduction in the rate of severe exacerbations and improved lung function in patients with previously uncontrolled, moderate to severe asthma. Full trial results are available at nejm.org.
Application in medicine. Dupilumab is a fully human anti-interleukin 4 receptor of monoclonal antibody that blocks both interleukin 4 and interleukin 13 signaling. We assessed its efficacy and safety in patients with uncontrolled asthma. Despite treatment, approximately 20% of patients with asthma have uncontrolled moderate to severe disease, with substantially reduced lung function and the risk of further loss of function over time. New research findings are summarized in a short video.
Can you please summarize the main findings of the study?
So the Dupilumab study, which was published in the New England Journal earlier this year, showed that in patients with moderate to severe asthma who had evidence for peripheral blood eosinophilia, that treatment with a receptor antibody, an antibody to the IL-4 or IL-13 receptor, actually had substantial improvements in their lung function, in exacerbations, in clinical symptoms, and in inflammatory markers following treatment with Dupilumab when added on to treatment with long-acting beta agonists and inhaled corticosteroids. There was improvement initially over the 4 weeks period of time where the patients were on all of their background medication, including high-dose combination therapy, and then the activity and efficacy improved and continued to persist for the remaining 8 weeks of the trial. So as the background medication was tapered off, the efficacy continued. Strikingly, there was an 87% reduction in asthma exacerbations, which were protocol defined by really loss of asthma control in the group that was treated with Dupilumab as compared to those without treatment with Dupilumab.
How do you think this study will affect patients with asthma in the future?
I think this study was really a landmark study because it was one of the first studies that actually identified phenotypically a group of patients with a biomarker for a type 2 related inflammatory response, i.e. blood eosinophils. And I think this study gives hope to patients with this type 2 associated asthma that even when they're on combination therapy, even when they're on the gold standard medications that we have for the treatment of asthma today, you can still get substantial improvements on top of that therapy, blocking a very specific pathway related to that type 2 inflammatory cascade, i.e. the IL-4 receptor.
Pros and cons. Dupilumab is a fully human-delivered monoclonal antibody that is direct against the alpha subunit of the interleukin-4 receptor, thereby blocking both interleukin-4 and interleukin-13 signaling and hence type 2 inflammation. This phase 3 trial, Liberty Asthma Quest, was designed to confirm early findings in patients with severe asthma. Type 2 inflammations mediated by cytokines, such as the ones we already mentioned, occurs in approximately 50% of patients with asthma. Blood and sputum levels of eosinophilia, the fraction of exhaled nitric oxide, and the serum of immunoglobulin A level have been linked to mechanisms involved in type 2 inflammation. Levels of serum immunoglobulin E and blood eosinophils can be used to guide the use of currently approved biological agents in the treatment of severe asthma.
IL-13 is a pleiotropic cytokine central to the type 2 response. It is produced by activated T cells, NKT cells, basophils, eosinophils, mast cells, innate type 2 cells, and monocytes, and is elevated in a subpopulation of patients with asthma. IL-13 acts by binding to IL-13R alpha-1, causing heterodimerization of the receptor with IL-4R alpha, and subsequent signaling. It is this signaling that makes IL-13 an important cytokine central to the type 2 inflammation that contributes to many key features of asthma, including mucus production, airway hyperresponsiveness, fibrosis, and IgE synthesis. IL-13 also plays a key role in reduced glucocorticoid receptor binding affinity and blocking glucocorticoid receptor translocation to the nucleus. IL-13 is elevated in patients with glucocorticoid insensitive asthma, correlates with severity of disease, and can also be elevated in patients that have experienced asthma exacerbations. Therefore, IL-13 blockade is an attractive therapeutic approach for the treatment of bronchial asthma.
Issue applied in Ecuador. This randomized double-blind placebo-controlled parallel group trial assessed the efficacy of Dupilumab in patients with uncontrolled moderate to severe asthma. Patients completed a screening period of 4 weeks, followed by a randomization to subcutaneous injections of Dupilumab or matched volume placebo, a 52-week randomized intervention period, and 12-week post-intervention follow-up period.
Hi, my name is Dr. Andy Whittemore. I'm Asthma UK's in-house GP. I'm here to talk to you about severe asthma. Here are some key points for you to take away. There are 250,000 people in the UK with what we call severe asthma. Severe asthma is a type of asthma where, despite people taking their regular preventive medication on a regular basis, understanding their triggers and looking after asthma as best as they can, they're still getting asthma symptoms. This is what we call severe asthma. Severe asthma affects 1 in 20 people in the UK with asthma. That's about 250,000 people. We still don't know enough about severe asthma. We don't quite understand why it affects some people and not others, and why some people develop it later in life or at different times in their life. There is some good news about severe asthma. Your specialist can now prescribe medications which really revolutionise some people's lifestyles. Asthma UK are really pushing hard to try and get more medication that can help even more people with severe asthma.
Conclusion. In this trial, patients who received Dupilumab had significantly lower rates of severe asthma exacerbation than those who received placebo, as well as better lung function and asthma control. Greater benefits were seen in patients with higher baseline levels of eosinophils. Hypereosinophilia was observed in some patients.
We have done studies with Dupilumab, as a product name. And these studies show that it works very nicely. It reduces the nasal polyp score, so the mass or the volume of nasal polyps, and with that the symptoms the patients have. So can't breathe, can breathe again, can't smell, can smell again. And quality of life is improving enormously. Patients are really more fit again, feel much better. We have a score out of 100. The patient would feel like 75 out of 100 in terms of problems, and that goes down to 10 out of 100, which is an enormous difference.
And that's it. Thank you.